purpose is to improve mental health and drug and alcohol services in Hertfordshire using the voice and the expertise of those who use the services. The reason I'm so proud of this piece of research is that it's given a really powerful voice to members of the transgender community in Hertfordshire. The project was led by Sonny Van Eden, a trans man, and that was the key to the success of the project. He was able to reach out to the trans community in Hertfordshire, and I don't think people would have come forward to offer their views and experiences without him.
This is a really good example of partnership working even with the changing NHS landscape, with the clinical commissioning groups, public health, working with the voluntary sector, working with the local community to make sure that services will be commissioned for this very hidden and marginalised community. As commissioners, we are really grateful to Sonny, to Viewpoint, to Healthwatch Hertfordshire, but particularly to members of the trans community for taking part in this health needs assessment, which will influence the way that future services are commissioned.
I'm Sonny, I'm a transitioning male and I'm from Hertford. I think really if I think about it, felt like I was on a tightrope, but the partnership of all the people were like a safety net for me, so I didn't feel alone if I was to fall. It was really important that that I was transitioning during this process, because then I could gain the trust and understood what the needs of the community were, and were able to articulate them with the language that we have as well, of understanding each other's needs. But there needs to be localised services, because we are a local community, we're part of the community in Hertfordshire, so we need to be able to access a health service here.
I got the initial contact by speaking to my GP, who had spoken to Sonny previously, and she gave me a survey to fill out, and I filled that out, and I'd hope they would help people find themselves and avoid all the mental anguish that so many of us go through, and all the depression and suicide attempts that many of us end up leading to.